So the morning of your liposuction procedure, we'll have you at the surgery center. It's about 100 yards from my office. It's a licensed, accredited outpatient surgery center. We'll have you meet with the anesthesia staff and the nurses. They'll get you all ready. Then I will come in and draw on you. We will stand you up, and we will typically use 2 or 3 different colored pens to mark areas we call the zone of adherence. Then we'll mark areas that may have little divots or dents that we may want to try to shift fat into. And then we'll topographically mark with kind of a topographic map, circles, the areas you want to treat. And once we have those all marked off, we'll get you into the operating room. We will oftentimes circumferentially prep you, meaning you'll be cleaned 360 degrees around each body part that we're going to work on. So if we're going to work on the front and back, we will clean the whole area. We typically will start on the back side and then finish that, then flip to one side or the other side, or sometime just flip back onto the back. And we'll treat all the areas circumferentially. And the incisions are very small. We try to hide them in inconspicuous places. So if someone has a little scar from a prior mole removal, I'll use that spot. I try not to set the incisions up like a ladder where they're perfectly symmetric. I try to put one little high, one little low, and that's kind of trying to throw off people. So if someone were to look at you, it doesn't want to look like you have a bunch of incisions that were placed there for liposuction. We can try to camouflage them and make it look like it's natural. And again, we don't want to have those incisions placed somewhere where they can be seen. We try to hide them, make them very minuscule. And after surgery, we will wrap you up in what's called a garment, a compression garment. So there's typically 2 types of garments, phase 1, phase 2. The first garment we'll place on you. It has clasps, hooks, zippers, so it's easy for us to get on in the operating room, which is important because you're asleep. And you'll wear that essentially for 1 week, 24 hours a day, take it off an hour a day to shower. The second week through the 4th week, we'll have you in a stage 2 garment, which essentially is like a Spanx shapewear garment. Even Under Armour makes some great spandex products, and we sell some, we have them for you, and we can just pick the size that works for you. Some people will buy their own, and you will wear that product generally 12 hours a day, 10 to 12 hours a day you'll wear that. Generally during the day you will wear it, and then you won't wear it at night when you go to bed. And that helps train the skin where to go, where to shrink, how to compress, and ultimately gives you the shape you're looking for.